Opioid and overdose-related deaths had already been at a crisis point before the COVID-19 pandemic, but isolation and reduced access to health care and community services have contributed to what some are calling a shadow pandemic. In this conversation, we take a closer look at what can be done on the ground to reduce harm, deal with the stigma of addiction, and what solutions can help the situation right now and in the future. This month's topic contains important but sensitive discussions around mental health and drug use and addiction. For more information on crisis resources and supports available to you, visit CAMH, Centre for Addiction and Mental Health, or the Canadian Centre on Substance Use and Addiction. Today, we have a panel of voices who are pushing for change and action. Let's have them introduce themselves. Debbie, we'll start with you. Please go ahead.
Hi, I'm Debbie Reed. I lost my son to an opioid overdose in March of 2022. I'm Johnny's mom.
Debbie, thank you so much for being on the program and our condolences. Crystal, please go next.
My name is Crystal Kimawan. I'm a frontline social worker. I also identify as a peer, so a person who has a lived experience with substance use. And through the pandemic, I too, I lost my partner last year in April to overdose.
Our condolences to you as well, Crystal. Thank you so much for being on the program. And Benjamin, could you introduce yourself next, please?
Yeah, hi, my name is Ben Perrin. I'm a law professor at the University of British Columbia in Vancouver. I'm also the author of a book called Overdose, Heartbreak and Hope in Canada's Opioid Crisis. And yeah, I just wanted to also just recognize Debbie and Crystal. Thank you for being here, and I'm also very sorry for your loss.
So Benjamin, I'll start with you. Or can I call you Ben as well?
Yeah, please.
All right. So in April of 2020, you co-wrote a column for the National Post with Jordan Westfall, and the column was called "A Perfect Storm: COVID-19 and the Opioid Crisis." And you wrote, quote, "Unfortunately, the best public health advice for responding to the opioid crisis is the precise opposite of that for COVID-19." That was really early on in the pandemic. It was the second month of pandemic rules in Canada. How were you able to recognize back then what would transpire with what is now being called a shadow pandemic?
Yeah, we actually wrote that piece a week into the first lockdown here in British Columbia. It was immediately obvious to myself and basically everybody who worked or researched in this area that what we were being told was necessary for protecting people during the COVID-19 pandemic was the exact opposite of the public health advice for the opioid crisis. And it starts with the idea that we needed to isolate and separate from each other for COVID, while what we need to do to address substance use and particularly overdose deaths is to not isolate. The top level advice for people who use substances to not use alone. And all the harm reduction measures and approaches, things like overdose prevention sites, those were either shut down or had their hours curtailed. We saw that the street drug supply get even more volatile and contaminated. And so many of the things that we needed to do to save lives during the opioid public health emergency, which still has not been declared in the province of Ontario, despite killing thousands of people, was the opposite. And the numbers bear that out tragically, and it has still not been addressed.
We're going to get more into that, and we're going to look at the numbers as well. But you mentioned that you did write a book about this. The book is called Overdose, Heartbreak and Hope in Canada's Opioid Crisis. And yet you were a top criminal justice advisor for former Prime Minister Stephen Harper. What led you to write this book?
Well, I went through a total, transformation of heart and mind. I've been a law professor since 2007, but I did take a year off of that job to go work in Prime Minister Harper's office in 2012. And when I came back to my job at UBC, I was driving to and from work and hearing, this is back in 2015-16, stories of individuals who had overdosed and died. And you almost never hear that now. We hear statistics and numbers in the thousands, but back then we were still hearing about individual news stories of individual people, loved ones who had passed away. And it became pretty clear this was not a one-off incident. It was a trend in BC the opioid crisis has been declared a public health emergency since 2016. And so it was shortly around then that I decided to research it. And because it was an ongoing emergency, you couldn't just go and read published research. I went out in the community, secured the funding and ethics approval, and started interviewing everyone and anyone who had anything to do with the issue. That included people with lived experience using substances, that included surviving family members who'd lost loved ones. It also included talking to all the criminal justice folks, judges, interviewed judges, prosecutors, defense lawyers, police. I also, public health and addictions experts, the First Nations Health Authority, Indigenous harm reduction organizations, you name it. And it led to a total change of my views on substance use to support things like decriminalization of people who use drugs, a safer supply, greater support for peer-based interventions, more holistic responses, those sorts of things. And so I hope that the book will help people who, like me, maybe think that by prosecuting and punishing people who use drugs, that somehow will get them into recovery or make them stop using. I'm hoping that book will help to address some of the concerns people have about some of the interventions that are necessary, and go through a similar kind of change that I went through as well.
And one more question, to give us a better understanding of what it is that we're talking about. Can you give us an overview of what opioids are and why they're so addictive?
So opioids are a type of drug which is essentially used to relieve pain. And there are naturally occurring opioids like heroin, people have no doubt heard of, but there also are synthetic opioids, which means that they're made in a lab. And in Canada today, we have a contaminated street drug supply. And so the vast majority, upwards of well over 90% of people who have died of overdose, died from taking street drugs. There are a proportion of people who've also died in Canada from using pharmaceutical drugs, but that is the minority of the total number of people who have died. And so what the reason why this contamination is driving this is that we're talking about a synthetic street drug like fentanyl, which has medical applications, but when it's created, literally, you can make it on your own. Part of my study was actually trying to find a recipe for fentanyl. It took me 5 minutes to find a recipe, and I verified with the U.S. National Security Lab in Livermore, California, that it was a bona fide recipe, that I would only need basic college level equipment and knowledge to create fentanyl in my own home. And so that's what the criminal underworld is doing. And you're talking about a substance which is substantially more potent than naturally occurring heroin. And we now have more potent analogs of fentanyl. That's chemical variants of it. They're also created in labs like carfentanil. So if anyone's watched any of the Jurassic World movies, you'll notice them talking about using carfentanil to sedate dinosaurs. Well, in the real world, it's used to sedate elephants and things like that. And yet that potent drug is being found in our drug supply. And so we're talking about literally grains of sand being the difference between a lethal and a non-lethal dose. And of course, it varies completely depending on someone's substance use profile. So these drugs, the fentanyl, was created for palliative cancer patients in the late 1950s. And it is being used today by people who are often self-medicating the pain in their lives, whether it relates to things like childhood trauma or things like that. And so we start to realize that we're not really primarily talking about, these aren't just all party drugs or something. It's that people who are often deeply wounded and have become addicted to these substances.
They're trying to soothe the pain. It's shocking that you can find this information online. To get a better understanding of the numbers, I wanted to take a look at some stats. This graph illustrates the rise of opioid-related deaths since 2016. There was a fairly significant jump from 2016 to 2017. And while it looks like it might be under some control between 2018 and 2019, we can see a sharp rise during the first two pandemic years from 1,559 to 2,460 in 2020 and 2,819 in 2021. Ben, you mentioned earlier that this should be declared a crisis, but in Ontario it hasn't. Why do you think it should be declared a public health emergency in this province?
Well, whenever you have, look at your graph, whenever you have thousands of people dying, that's a definition of a public health emergency. And they're dying in increasing numbers. In British Columbia, when we've looked at the graph and you pull it out, it's actually even a steeper incline beginning around 2013, 2014. Opioid-related overdose deaths in British Columbia, I'm not sure the Ontario equivalents, but I'm quite sure it's very, very similar, if not identical. Opioid-related overdose deaths in BC is the leading cause of unnatural death. That means that there's more people who die of drug overdose, illicit drug overdose, than die of homicide, suicide, car accidents, and pharmaceutical overdoses combined. And so when we've got something that is literally taking the lives of the equivalent of a fully loaded 747 passenger jet every month or so, if that's not a public health emergency, I don't know what it is. And in fact, more people died from overdose deaths in 2020 than died of COVID-19 in British Columbia. And so how do we account for the difference? Well, it's very straightforward for me. It seems imminently clear that it's that some people's lives just don't matter. People who use drugs, research has shown our society has the highest level of stigma for. Stigma is a fancy word for opprobrium, vitriol. So when people are asked, who do you disdain the most? And they're asked a big list of categories of professions and people who use drugs are at the top of that list. And that's true internationally with a World Health Organization study. So that's why I say it's not just about, head knowledge of, reading peer-reviewed studies saying that things like overdose prevention sites save lives. People's hearts need to transform and change if they're not there yet. And for some people who've contacted me, they tell me that the change happened because someone close to them, they found out was using, and it was only after they passed away tragically. And so, I didn't know anyone who had passed away from an overdose-related death when I wrote my book, Overdose. Many people think that must have been why. It wasn't. It was only after I published the book that there were two people that I know who passed away from overdose death.
I definitely, as an Indigenous woman in Northern Ontario, as a person who identifies as a substance user with lived experience, I definitely felt that. As a frontline harm reduction worker who is often accompanying our community members to healthcare specific appointments, this is definitely something we see, experience, and feel on the daily in our line of work. So I was just in total agreement to that. It's felt, it's seen, it's witnessed. Yeah.
That must be a really hard thing to hear and to recognize yourself in it. Sudbury is one of the hardest hit cities for opioid-related deaths. Now you're also working in Toronto. In your work as a peer support worker, what have you noticed about the difference in available resources to help people?
Now, again, yes, I do work in Toronto. In Toronto, I'm actually a coordinator of Indigenous community engagement with a frontline community service org. Now, when I was working in Toronto or in Sudbury, I was just a frontline support worker, identifying as a peer. I have a social work background. I have a degree. But within this community, Sudbury has a long way to go. I know we look to BC a lot and we rely on what's coming about in British Columbia in the line of frontline work that we do here. But we're rural up here, we're remote, we're Northern Ontario, and the diversity that we see within Toronto, and maybe places like BC, I've never been to BC, but Toronto is far more diverse. There are a lot of culturally specific services available to community members that Sudbury just does not have. Experiencing discrimination, racism within our healthcare system here in Sudbury is very real. And when previous speaker had mentioned that, our hearts need to change. Our hearts do need to change. These are, yes, stats, but they are partners. They are sons. They are daughters. They are relations. I cannot even count on my hand alone the amount of close family members, friends, peers we've lost since the pandemic has started. And it's exhausting. It's exhausting being a frontline worker. It's exhausting being an Indigenous frontline worker, working within Northern Ontario. It's just, yeah.
Why do you do the work that you do? Because we know we've been hearing a lot of about burnout, especially for people working on the front lines. So why do you do the work that you do?
When our lawyer had mentioned, our hearts need to change, I think my heart is just where it needs to be. Again, as an Indigenous person, we live with this innate responsibility. I call it a responsibility of giving back to a time and space that has made me me. I've experienced that racism, discrimination by policing, by healthcare, navigating through my own trauma and my own healing. And I know it's hard, and I know I could not have done it alone. And we need support. We need strong advocates. And the reality of it is, since the pandemic has hit, like some of our stats as Indigenous people, we've seen 132% increase within the first year of pandemic of Indigenous opioid-related overdoses and deaths. 68%, this is just within Ontario. We isolate communities. At the start of the pandemic and the restrictions, I was within the child welfare. So I was working with a lot of mothers, reuniting families. Now, I mentioned this in a previous interview that our organization was just not prepared for how restrictions would impact family dynamics. We had we had lost 4 mothers within the first month and a half to 2 months of the pandemic. Mothers who were in active recovery and accessing resources that just all of a sudden stopped. Access with children, those were highlights of the week and the month that our mothers looked forward to, and all of a sudden there was no access, and they're isolated, or their children are isolated. Like even being able to offer such means as this, Skype, to be able to have that interaction and check-ins between mothers, we just were not ready. And unfortunately, a lot of mothers who were strong in their recovery relapsed. And using maybe the same amount they would have used a year prior or 6 months. And those doses are lethal. You cannot go back to that same amount of dose. You cannot have 2 weeks, 4 months of recovery and just start off where you left off. So it's been heartbreaking, and it continues to be heartbreaking because the numbers are still rising. A lot of our frontline workers that were active in the height of the pandemic and restrictions were burnt out. Resources for us as helpers were non-existent as well. So we were facing in a continuous cycle of grief and trying to support community members, parents who were losing children, partners losing their partners. It was, I don't even know how a lot of us made it through, but I know a number of my colleagues are on a wellness leave, and just to replenish and return back and continue doing the work.
Debbie, as you were listening to Crystal talked about these are not just numbers. These are people. These are mothers. These are sons. These family members. These are individuals. What happened to your son?
Well, my son was medically addicted. He had an accident. He had 2 accidents in the first year. I guess he was about 18. And I was so ignorant to the fact that the Percocet that he was taking was so addictive. And I think, it made him feel good, and he became addicted, and he was later had a surgery that year and continued to use, and his use escalated into hydromorphone. He did have many years of recovery, but he had a trauma in his life, a breakup. He and his partner, 2 children, and he went straight back into the bowels of addiction. And this time he went into using fentanyl. So a lot happened. It was really a year and a half of tragedy, watching him turn into somebody that was completely unrecognizable to me, not just personality-wise, but also physically. He went from being, about 265 pounds of muscle to 150 pounds of skin and bone running the streets. And that type of behavior inevitably sort of aligns with criminal behavior. And he got into a high-speed chase with the police. He was impaired. I saw it as an opportunity to get him off that fentanyl. Nobody ever wants to think, great, my kid's going to jail, but I did go to see the district attorney and said to her, please, this might be the only chance that he has to live. Please keep him in here. And they did. And he suffered horribly in the prison. The numbers were off the charts. They were understaffed. It was a horrible place to be. After about 6 months, he was starting to do his recovery talk again, and I let him out of jail. I provided surety for him, and he bounced me at the mall. And 2 days later, he passed away at the Thunder Bay Emergency General Hospital. He overdosed while he was in the hospital. He must have. He just died behind a curtain and nobody noticed, with all the life-saving supports around him, and nobody noticed. He went in there escorted by the police. He also has brown skin, and he had been in that hospital more than once with addiction issues. So the stigma attached to having brown skin and being an addict and being escorted by police, I think, affected his care. So Johnny passed away on March 8th of 2020. And I found myself alone here during a pandemic to sort of try to wade through the grief and wade through the grief of his children and, of course, his ex-partner. Addiction's a very heavy burden to carry. Even in recovery, they're not the same. So the ripple effect from Johnny's death has been significant. His children are affected. My family is affected. I was Johnny's codependent.
What do you mean by that?
Well, when he would fall, I would pick him up. If he didn't pay his bills, I paid them for him. I paid his union dues at work so he wouldn't get behind. If he was spending all his money on drugs, I made sure that the family had groceries and diapers for the kids. But I just enabled him to be able to spend more money on drugs.
Could you look, not to interrupt you, Debbie, not to interrupt you at all. Could it also be you are his mother and you were trying to do what mothers do, which is to try to help take care of him?
This is a terrible disease, and it goes against the laws of nature. We want to protect our children and have them safe. And recovery programs for the parents teach you to step back so they can stand up. That is a very difficult thing to do because parents of those in active addiction are clasped in fear every minute of the day. Is my kid going to die? Is there a way out? What is the way out? And where is bottom? Is bottom going to be the grave? They tell you to detach with love, but I don't know what that looks like. I've been to a treatment program for myself to try and make sense of all this because it went on for years, and it's so fearful. You're so fearful. I went to bed crying. I woke up crying. My first thought was him. My mind was completely trapped in his addiction. I was just as addicted to him as he was to his drugs.
How did you manage to cope during the pandemic? Because your son died March of 2020, and not only did you have to navigate this new world that we were going into where everything was so uncertain, but you were also dealing with the grief of your son dying and the way that he died. How did you cope during that time?
Well, I guess I work at a medical university here in Thunder Bay, so I do have connections to some great doctors and a great family health team that sort of dragged me through. They put me on meds for an antidepressant, but honestly, I just folded in half. I would say I spent probably 4 months, almost 4 months, barely getting out of bed. I didn't have a support system in place, and it was super hard. You know, I had friends that reach out, you know, through text, but I was so grief stricken that I could barely look at my phone, and people were reaching out to me, and I couldn't answer them. It certainly still to this day has had a big impact on my mental health, and I have to be very diligent to keep moving.
Thank you, Debbie, for sharing everything that you've shared. I know it's very traumatic to talk about this, and we really do appreciate you sharing what happened with your son, Johnny. On TVO, prior to the pandemic in the fall of 2019, Ontario's chief coroner, Dr. Dirk Heyer, talked about how official statistics fall behind the tragedies in communities. Let's take a look at what he said.
They knew that there was trouble at the consumption and treatment service when they saw during January and February and March people suffering much more significant overdose and much more quickly. That's the kind of information that we need to work together to bring to the forefront as quickly as possible to allow people to understand the challenges. We investigate death, and that takes us a while to get that information. And it's frustrating because every person that dies and every investigation we do is a story of a person. And those stories are profound. And so what we're trying to do is to work with everybody to recognize that it's not just waiting for us to give the numbers, but to work on what information that we have as quickly as possible.
Crystal, as Dr. Heyer said there, people making decisions wait on stats that are slow to come to light. What has to happen to engage more people who can make decisions about providing more resources at exactly the time that they're needed?
I always find this rather frustrating, how slowly change occurs. Now, as an Indigenous individual living within Canada, my people have felt this for a very long time. Change is slow, but change does happen. I think really bringing it back to the real lived stories like that of Debbie and sharing her story and really getting the emotional component of it out, the emotional aspect of it out that, you know, even, you know, Debbie, you were positioned in a place to be able to access those services when you had lost your son. And that is, I relied on a lot of my colleagues too when I had lost my partner. We were really just relying on one another, especially through the pandemic. What needs to change? I think how the healthcare system views the substance user, and really looking at it from a medical standpoint. When you look at the multifactorial components of this disorder, there's trauma. There's even within Debbie's story, her son, it involved an accident. It was ongoing. The addiction progressed, and our lack of understanding and knowing how addiction works and how it progresses, could change a lot of outcomes. How we view a person who is battling addiction and mental health, that these are people, these are daughters, these are sisters, these are children, these are mothers. And I really felt, Debbie, when you had mentioned that his skin was brown, it hit me. And every time, I hear how that treatment differs for marginalized individuals, people of color, it hits. I'm a person of color. So I again, my condolences to you, Debbie, for experiencing that. And the healthcare, that's the real truth, is when racialized people, ethno differences, diversity enter into the healthcare system, especially within Northern Ontario. And Debbie, you're further up, you're Thunder Bay. And we hear a lot of stories about racism and discrimination in the line of work that we do here within Sudbury. And honestly, we're not in Thunder Bay. We could be in Thunder Bay. It's not as bad as Thunder Bay. And then now I'm in Toronto, and wow, it is so diverse here. So I know this as a frontline worker, that, this is the legacy of colonialism, racism, and intergenerational trauma that is ongoing. And, it's resulting in substantial health and social harms that are still being felt and kind of ignored. I think we shift focus. And when we're shifting focus, we're still ignoring on the root cause of what we're facing on the front line. It doesn't do any good to shift focus. If anything, our perspective and our view at a solution should broaden. When we know this, it should also be included in our approach in how to remedy this. Not, okay, this is a more pressing issue, let's deal with this, because we're not fixing anything when we leave the social factors out of it, Yes, the fentanyl and the drug supply is much more lethal. Let's focus on that and shift our focus. No, it just needs to be a collective measure in how we go about addressing this crisis. And it is a crisis. What is it going to take? Who does it have to hit higher up in those social and government ladders of how close does it have to get in order for it to matter to you? And that's really where I'm at. I'm exhausted. A lot of us are. We rely on each other. Anybody who's lost someone to overdose, there's an immediate connection. And I don't care what color you are. If you've experienced loss to overdose, a loved one to overdose, immediately that's your community. And these are communities that are being built. And let's listen and listen to these stories and Debbie's stories and how we shape those policies that are designed to meet the grieving mother, the grieving partner, the Indigenous grieving mother. There is a real need to tailor healthcare services that are culturally relevant to the client that is walking through those doors. We're emotional, physical, spiritual beings. We all have a belief in something. And that is so vital, especially coming from an Indigenous standpoint. That is vital to me as an Indigenous person, caring for my spiritual needs, emotional needs, physical, and mental as well,
And
there's
Ben,
such a silo. Yeah.
You brought up so many great points, Crystal, and one of the points that I wanted to follow up with, Ben, is that before the pandemic, we would hear that governments can't do X, Y, Z because it's impossible or it can't be done. But during the pandemic, we saw that governments could do things that have never been done before. We know the government can fund a pandemic, Ben. Can we assume if the will was there, they'd come up with more resources for what's happening with the opioid crisis?
Absolutely, but it's really not even a matter of resources at all. We know from the research that investing every dollar, for example, invested in treatment and recovery saves up to $12 in healthcare and criminal justice expenses. So this is actually not even a question about, oh, we don't have enough money. It's a lack of political will, and I just want to completely agree with what Crystal said a moment ago about who is impacted, and that the harms that we're seeing here are a direct outflowing in Indigenous communities of the ongoing legacies of colonialism, and including the residential schools system, the scoops, and the ongoing Indigenous child welfare crisis, and the disproportionate incarceration of Indigenous people and Black folks, that these are all deeply interconnected. And so as you go back to those roots, kind of my approach that I took in the book was, first of all, we need to keep people alive. So we're starting with emergency measures to keep people alive today. And then we start to go back to kind of, what are some of the policy changes, and then going deeper, what are some of the underlying issues and causes that need to be addressed. So when we look at things like the research around childhood trauma, we know that dramatically increases someone's likelihood of, first of all, using substances and then overdosing and dying. We also have studies that show that just on average, the kind of common experience of many people in the residential school system, people will be very well aware now, that increased adverse childhood experiences is not only just passed on through the intergenerational impacts of through parenting and through being in an environment where someone has had their language, their culture, their way of life suppressed and criminalized for decades and decades and decades. But there's also emerging research that shows that this trauma passes on genetically. And so even if someone never actually knew or was raised by their biological parent who was a residential school survivor, that they see the knock-on effects of this. So the way that our society deals with substance use is typically to blame and shame the person who's using drugs. And the point I make in my book is that we need to look in the mirror. If we're looking for someone, and I say we, I'm talking about Canadians writ large, and particularly white Canada, which I'm a part of. I'm not talking about the folks in this panel. Those who the decision makers are primarily listening to on this issue, because they're not listening to people who use drugs. They're not listening to public health officials. They're not listening to Indigenous advocates. They're listening to voters. And it's people like conservative leadership candidate Pierre Poilievre, who was out just this month saying that the solution to this problem is to more of the same, cracking down in a criminal justice response. We've also seen premiers in Alberta and Ontario actively opposing life-saving harm reduction measures like overdose prevention sites. So it's about politics. This is not about money.
Well, the Center for Addiction and Mental Health says that people with a mental illness are twice as likely to have a substance use disorder compared to the general population. Earlier this month, I spoke to Diana Chan McNally, a Toronto community support worker, about the connection between mental health and addiction, and as it relates to the pandemic. Let's take a look.
People who are living with homelessness especially, it's like being in survival mode 24/7. It really is. And again, even when you're in the shelter system, it's a very carceral kind of setting. And it is not a safe setting for lots of different reasons, not just things like assault and theft, which have skyrocketed during the pandemic, but you're talking about people who are using drugs. They're stressed out. And so people will use more because they are not offered any other coping mechanisms that are viable for them. It's what they have available, and I think it's a tool that no one can judge them for that at all. No one should ever judge anyone for that.
Debbie, I wanted to follow up with you. Isolation has been a big part of the pandemic. Can you help us understand why using alone is so dangerous with opioids?
Well, I think that a lot of the people in active addiction are very aware now that using alone is a very dangerous thing to do. And a lot of them are carrying naloxone kits with them. We have a group of moms here in Thunder Bay that have come together as a result of losing our children. And there's a lot of us, and we are working with the city to create a memorial site We see the pushback from the community in general for honoring junkies or let them die. We hear responses like that. But while we've been down in this community, we adorn a tree with pictures of our lost loved ones. We do walks. We dress in purple. And there's been on our walks multiple occasions where we have had to use the naloxone kits that we carry with us to revive. We have an app called the Lifeguard app that a lot of people here in Thunder Bay, I don't know how widespread, I think it was developed by a fellow who lost his son in BC. And we get notifications. And so when I get a notification on my phone of a particular substance, I put that up onto my Facebook account, and always with the message, don't use alone.
We'll make sure to share the information for that app. We do have a question from someone who has been watching the conversation. This is a question from Alex, and they ask, do doctors not have any responsibility for prescribing these drugs? Is there no follow-up after these highly addictive medications are prescribed? Who would like to take this?
Well, I will speak to a little bit of something there. I took my son to emergency. He was in recovery and had been for quite some time. He had a workplace accident. He got hit in the shoulder with a big boulder, and fortunately for him, he was well muscled at the time, but he was in a lot of pain. And I got a text message from his supervisor and said, I brought him into emergency. And my first thought was, oh my God, their frontline defense against pain is morphine. And I raced over to the hospital. The university is just basically across the street. But by the time I got there, he was very doe-eyed, and I knew what had happened. And I went to the desk and I confronted a nurse, and I said, he's an addict. And he said, well, we didn't know that's what we give for pain. It's our go-to. It's our frontline battle to, use against somebody who's suffering. And so later from that, I had a conversation with another emergency doctor after Johnny had passed away. And I said to him, how could that happen? How could they not know? I had him into the hospital on multiple occasions. How could they not know? And he said, we really don't dig down into the files. And oftentimes when they come in a drug psychosis, they're handed over to the mental health team, which transfers them over to the psych department, and they're not sharing records. So that's a big gap when you're taking someone into Emerge.
And that must feel like a punch in the stomach, Crystal. If you've been clean and then you end up in Emerge, and then you're given something that you shouldn't be taken, and then you relapse. Do you see what needs to be done to change that, Crystal?
I think, again, going back to what Ben had said, there's a lot of work in the frontline healthcare system that needs to be done. And I don't think they see it as, as a priority. It's not a priority to treat people equally and with the same approach across the board, especially within Northern Ontario, and I've seen it a lot. Now, I've been in this situation before where I had my gallbladder removed, I think about 12 years ago. And it was painful. I was prescribed hydromorphine when it got really bad and I went into the hospital. I was prescribed Dilaudid. And this was going on about 3 months. And it almost seemed like it was intentional. Why are you not removing my gallbladder? It seemed, and then finally I had come, and it was actually an East Indian doctor who said, "Why do you still have your gallbladder?" And I said, you guys are the doctors, you tell me. So she said, we're going to dislodge the stones, and after that, as a recovering addict in active recovery, and it was so much to the point where you get a taste of that. And I could really understand, Debbie, when you had mentioned, your son, it's a euphoric, you rely on it for the pain, and then it becomes a dependency. And I had felt how mine was increasing to the point where I was taking medication even before like an attack, or so to speak, as a way of relieving myself of the pain beforehand. And then it was like when I was in a painful state, if I could maybe find a way to inject these hydromorphines, then it would alleviate the pain entirely. So once I actually had my gallbladder removed, it was my own recognition as somebody who lives with a substance use disorder, how quickly it escalated. And also how angry I was at the healthcare system, that the only solution seemed to be to continue me on pain medication and never mind removing the root cause of the issue. So I've been through this, I've experienced, and once my gallbladder was actually removed, I refused pain meds, and they were, are you sure this is going to be really painful? I had this, the bag outside of my body to collect any sort of infection. And my whatever the blood cell, T cells or whatever, had increased so much where I had gone to emerge, and they were actually surprised I was still alive. Like, how are you even here right now? The infection is spreading throughout your body. So it was like, no, I'm not taking any pain meds. I was angry with myself for wanting to become dependent on them and looking at a faster way of consumption, but also at the healthcare system for just keeping that prolonged. And I see a lot of that. But on the opposite end, I also see people who are actually in pain, just denied at that point of contact, maybe because of history. So when you look at that substance use, yes, if we're not in a state as a person with lived experience to be able to say, no, I do have a substance use disorder or addiction issues or lived experience, and I don't want pain meds, and we're not fully able to advocate for ourselves, which is why the importance of Sudbury has tried to do it. I know a couple of colleagues who have tried to act as that buffer for somebody with lived experience or struggling with substance use who enters into the healthcare system, to act as an advocate through, because Sudbury does recognize that our homeless substance using community members don't get treated appropriately within our healthcare system. So the fact that our healthcare system has recognized a need for peer support advocates, it says a lot. We're trying, but also where is our capacity as peer supports to be able to navigate those institutions and structures that are so, have a long history and a firm perspective and worldview on the homeless person and the substance using. It's tough work as a peer advocate to be able to support our community members within those institutions.
And Ben, when this sounds like this conversation is about fairness, about inequality. Last month, British Columbia became the first jurisdiction in Canada to legally allow people to carry up to 2.5 grams of illicit drugs. What's the difference between decriminalization and legalization, and why was this move important?
Yeah, so first off, legalization is what we currently have in Canada with, alcohol and cigarettes and cannabis. So anyone who's over a certain age can legally go and purchase a certain quantity. The products are regulated, what's in them, and there's, health and safety checks and stuff that are kind of built in. Decriminalization is different than that. Decriminalization simply means if you have a substance, we're not going to ask where you got it. We're not going to necessarily provide it to you legally. But if you have that substance, you're not going to be liable to criminal conviction and prosecution. So it just basically says we're going to leave you alone. That's decriminalization. And so the reason why decriminalizing people who use drugs is one part, there's nothing here that's the whole solution, but it's one part of what needs to be done, is that it will begin to shift things from being treating as a criminal law issue. The idea that if we punish you and sanction you, that will somehow help you stop using. We know that that's not true. We know that that's completely contrary to what we know about addictions to begin with. but we also know that it's deadly. The research shows that, in fact, one of the greatest risks for someone is when they've just been released. Is we've quite tragically heard with Debbie's son, recently released from prison, and so someone who's released from custody is actually 50 times more likely to overdose and die than someone who's in the general population. And I'm not sure if Ontario's released statistics. It's because your tolerance rapidly decreases. So whether you're in and also Crystal mentioned this too, for people who are in recovery or clean, she mentioned or haven't been using rather for 2 weeks, I think she said, or a month or two, is your tolerance rapidly decreases as your substance use slows down. It happens very, very quickly. And so when you consider that these are chronic relapsing conditions, meaning that you can't just stop using, people are able to get into long-term recovery, but the general situation is that these are chronic relapsing conditions, that when they do use again, even if it's a fraction of what they were using before, their body just isn't able to process that, and they overdose, and that they're at greater risk of dying, because when you're released from prison, you're typically subject to conditions that you not use substances. And so I've spoken with people. Part of my research for a new study involves speaking with folks with lived experience in the criminal justice system. And in some provinces, upwards of half of everyone who has died of overdose was recently spent time in custody. And so for many people who use substances, spending their time in prison, because they're not given the support by the system after they're released, in many cases is a death sentence for them. And so we need to take the criminalization of people who use drugs out of the picture, and instead we need to replace it with a compassionate, evidence-based approach, one that supports the well-being of people in a much more holistic way. Here in BC, we have the BC First Nations Health Authority, which is the first of its kind in Canada, which provides healthcare services to Indigenous people throughout the province. They do a tremendous amount of work on this issue because, again, Indigenous people are significantly disproportionately affected by overdoses and overdose deaths, in particular Indigenous women, and so in comparison to non-Indigenous women. And they're supporting, as you heard a moment ago from Crystal, the need for culturally appropriate options. So things like on-the-land healing and recovery programs and those sorts of things. And, bringing in what we know from medical science, but what we also know from traditional ways of being. And I think it just bears mentioning that, we talk about substances. These substances were introduced through colonialism, right? So even if we just start with alcohol, there's a tremendous history of harm, which is ongoing. Alcohol actually kills more people in Canada than opioids do, and we're not talking about that at all. And yet Indigenous peoples in many parts of the country were actively resisting the introduction of alcohol because the harm they saw it caused, including in provinces like Saskatchewan, where it was actually part of treaty negotiations that alcohol not be allowed to enter in. And instead of honoring its treaty obligations, the late Harold Johnson wrote a book called Firewater, talked about this, and he said, look, instead of doing that, Canada criminalized Indigenous people for possessing alcohol. That was an offense under the Indian Act. So there's a lengthy, centuries-long story to be told here of the introduction of trauma against Indigenous peoples, then the introduction of the maladaptive coping strategy of substances, which causes more harm, and then the harms of death and violence that those things can fuel in communities. And then that cycle repeats itself: trauma, substance use, death, repeat. And again, we've got to really take a hard look in the mirror at this. And our society just is not doing that. It has not been willing to do that. It doesn't make for a quick soundbite. It doesn't win votes. And I quite frankly I'm appalled at what I see happening in provinces like Ontario, with Premier Ford's government actively opposing what we know the evidence shows will and does save lives. And his government is continuing to through funding and through policy decisions, impede life-saving things like overdose prevention sites, things like expanding a safer supply of drugs, things like making a request like BC did to decriminalize people who use drugs. It's not just an accident that BC decriminalized drugs. Our province asked for it. Premier John Horgan made an official request to exempt our province so that people in BC would not be treated like criminals who use drugs. And this is supported by the Canadian Association of Chiefs of Police even. So Premier Ford thinks he knows better than the chiefs of police what's needed for public safety. He thinks he knows what's needed than, for example, the city of Toronto, which has actually asked for a similar exemption on public health grounds. Who are we going to listen to on these policies? I think politicians need to get out of the way, and they need to allow people like the folks who are, speaking alongside me on this program, who've shared with you what's needed and what the research is showing.
We have about 5 minutes left, and I have a few more questions to get to. Crystal, part of this conversation has been to have a safe drug supply. Do you think that a safe supply is needed to prevent death and to curb what's happening right now with the opioid crisis?
Definitely, yes. I know, again, because I have some experience within Toronto, we do have a select few doctors who do prescribe synthetic, Dilaudid for opiate users. It is a controlled drug supply. It is keeping people alive versus having to acquire their drug of choice on the street. So yes, does it save lives? Does it keep our community members alive? Yes, it does. And is it needed? Yes.
Debbie, in your article for TVO, we spoke to you during the election. You said one of the pieces that I really feel is missing is research into healing the brain. I think you can put all of these programs in place, and it's still probably the only disease where the person has to recover themselves. What did you mean by that, Debbie? Well,
we know that there's brain damage. We know that the brain has been remapped, and there are substances that speak, because when my son was in the throes of addiction, I had my head buried into the internet, anything and everything that I could think of to help him in ways that he really didn't want to be helped, including plant medicine healing like Ibogaine, which has been lauded to remap the brain away from addiction. And yet those are all underground clinics here in Canada. So we have a long way to go in terms of helping these people. They're mentally unhealthy, and they have to jump through one hoop after another to try and gain access to resources. And that's why having a safe supply put in place gives the people on the ground an opportunity to have that conversation and say, look, here's what's available. Let me help you. When you're ready, come back, we'll talk, have that conversation, plant the seeds in their mind that there is hope. It's a very complex and very difficult disease to manage. Our detox center last year turned away over 3,000 people. The people on the streets that were living on the streets during COVID had limited resources. There was not even any place for them to use a washroom. It's really, really challenging. And so a group of us moms have got together. Carolyn Carl is a mom that lost her daughter last September. She had a really good support system in place, and she jumped on the bandwagon and has spearheaded a lot of great initiatives here in Thunder Bay, including a proposal for 20 more detox beds here in town. But it's not just detoxing and going to a 28-day treatment program. The aftercare is so important, and I saw that with my son. And the more he tried to get back to a normal life, and care for his family and work that job and spend quality time with the kids, meant that he was disconnecting from his recovery community. And that is so key to remaining on track with this disease. It's just essential. Connection is the opposite of addiction. And they may not be isolated in terms of having friends and whatnot around them, but they are isolated when they try to get back to that normal life. They're isolated from the recovery community. And it's really difficult. And some of the recovery meetings are very triggering for people in recovery because a lot of them will come there and it's a place to use. So it's a very complicated thing.
Debbie, what you said, connection is the opposite of addiction. Ben, when we're talking about this, it seems as if there's so much to unpack around what's happening with the opioid crisis. In your book, you said, I hope that one day in my lifetime, there'll be a public inquiry into the opioid crisis. Do you think that will ever happen?
Yeah, I sure do. I do want to say one thing about detox, just because there's a lot of people watching and people who may be looking for hope and such. There is hope, absolutely. Detox alone without other supports, and there are other supports available, including some, fairly new medications people not be familiar with, but just straight up detox cold turkey is not recommended. It's Canadian Medical Association guidelines in the journal don't recommend that because, again, this issue of rapidly declining tolerance, and if you do relapse, you're more likely to die. So there are studies in the British Medical Journal that 28-day detox programs alone actually increase your death of overdose. So I just wanted to make sure that was on the table. But yeah, I think there needs to be accountability, and there has to be. Whenever you have tens of thousands of people dying, and there is evidence to show what could help save lives, and decision makers choose not to follow that evidence, there needs to be accountability. And so we know from the history of atrocity and injustice that can take years, decades, or centuries. But at some point, someone decides in power, we're going to look into this, and names will be named. And those politicians, those leaders, other individuals who stood against what we know to save lives, and they did so for the wrong reasons, for political reasons, they are going to be held accountable. And I very much hope that's the case. And I also include, Prime Minister Justin Trudeau and his government in that as well. Like we have on the record in my research that they are continuing to resist decriminalizing people who use drugs in particular for political reasons. And so there is accountability to be had there as well. And while there's been this partial decriminalization pilot in BC, it's only for 3 years. It only applies to over 18. It applies to thresholds that are lower than what people who use substances say is needed. And at the end of the day, it only applies in BC, but almost three quarters of all overdose deaths occurred outside of BC, including in provinces like Ontario, which has among the highest per capita overdose death rates of anywhere in the country.
I wish we had more time to talk about this. I do want to thank Crystal and Debbie for speaking to us about your lived experience and about the pain that you've had to go through. That is a lot of emotional labor, and we do appreciate you being on the show and sharing that with us. And hopefully this is the beginning of a conversation people need to have more with their family and friends. And Ben, as you said, minds can be changed. Your mind was changed. And thank you all for being on the program. We appreciate it. That's all the time we have now. Thank you for joining us online, and thank you, our guest, for your insights. Thanks so much. We'll see you next time.
That chat was part of The Thread with Nam Kiwanuka. For more content like this, hit the subscribe button and check out our other videos. Also, don't forget to follow us on Instagram @TVO The Thread. Thanks, and we'll see you next time.